And tell us a little bit about your Parkinson's diagnosis
Okay.
and how being diagnosed with Parkinson's has affected your life.
Right. I was first diagnosed in December 2008. I was starting to show tremors, and I was totally fatigued all the time. And those were the outward signs. My voice had gotten really soft, and my wife finally made me go see a general practitioner, and he did a few road tests, I guess if you call it that, and his impression was that it was Parkinson's disease, and I was seeing a specialist the next day, and they confirmed that. I play piano for a living, more or less, most of the time, or do studio work, so that was my job, and I was really starting to have less and less facility, obviously, as PD is a motor disorder, motion disorder, and I was particularly, it was affecting me on the right-hand side. So my playing had started to really deteriorate at that point. And my wife was always looking around for people that would be able to help out our situation. And this is one of those calls that we made, obviously. Another one was the Muhammad Ali Parkinson Center right here in Phoenix, where I met a wonderful doctor, Tony Santiago, give him a shout out, Dr. T. And we got some balance in our brain chemicals, which was basically antidepressant and some other some drugs, Azilect, one of them, and amantadine, in addition to the carbidopa levodopa, which helped quite a bit. I was feeling much better. My mood was very much better, especially with the Lexapro, the serotonin balance. So that was pretty good, but I was still playing maybe at 60%, 65% of capacity. So fast forward, they put me on levodopa carbidopa, which is 25 milligram, 100 milligram, which is a standard. And we tried some other things, ropinirole, which I didn't tolerate well. And so basically I was just on the levodopa carbidopa, and I wasn't making any progress at all in terms of regaining any of my facility. I was getting very frustrated as a musician, and basically ran into a situation where I became, clinically depressed and everything like that. So life was kind of tough at that time. One of the things, my face has got a little bit more liveliness to it instead of a mass, which is one of the PD symptoms. In fact, I got a huge compliment from doing it. You up there throwing haymakers, brother? Because the guys I play with, we're good because we're old. A very experienced veteran musician, and like I said, when I didn't have the facility or as much, you just kind of blend in the background a little bit and try not to stick out, which is not my natural style.
And Chris, has your wife noticed any changes, not just in your ability to play, but has she noticed any other changes at home or when you guys are out and about? What has she said about your recovery,
Right.
And your rehabilitation?
Well, yeah, I wobble less. I used to stand and have a little bit of a wobble to my, again, part of the balance thing I thought of, but, the postural instabilities. She noticed that and mentioned that, made mention of that, I'm less wavy in the wind. My voice is better. It's a little rough today. I got a little bit of a cold, but louder, doesn't trail off. Also, just, general mood, I'm not such a curmudgeon, although that is my natural personality. I got a call out of the blue from Dr. Kukurin's office, and there was a gentleman coming down named Dr. Yuri Danilov, I believe his last name is pronounced, and he's a big old Russian guy, and no nonsense, and they got me in here and we're doing some kind of stretches, and I'm putting this thing in my mouth, this electronic stimulator, and we did 4 days in a row, and after day one, I didn't really feel any. I felt frustrated because Dr. Daniel was difficult to understand, and I didn't understand what he was trying to do. And day two was a little bit about the same. What I noticed is by day three, I still stuck with the program, and I noticed improvements in my posture, which is one of the problems I've been having. My neck was tilting to the right, and creating not only pain, but just an imbalance. So we started working on that, and symptom-wise, my balance has been pretty bad, because you don't have a problem with balance, you just have a problem with mechanics, postural mechanics, basically. So we've been doing some stretching and using the vibrating table, all with this PONS unit. And and one of the things he noticed right off started day three, was my walking. I was tripping over my own feet. I said my left leg was crossing over, especially when I would turn and stuff, and I would just start to lose balance, which is kind of scary. We worked on that, and it's going to sound like a miracle, but it helped that day. I mean, I couldn't believe that I was walking around my house, and noticed that after one session with that, my walk, my gait had become better, and next day was even better. So I had some very quick results, and very pleased with it. It was. I still don't understand all the ins and outs of what we're doing, but I'm seeing results, and the results are just a better mood, less back pain, less problems walking, and even my voice which is kind of naturally soft and sexy, has some strength come back to it. So we're now working with Dr. Kukurin to build upon those results, and like I said, we're using the vibrating table and the treadmill and a lot of balance things. So I'm building up some muscles, like in my ankles, that this is just accumulating, and my playing is. And here's the thing: it was really crazy. The first Thursday, that was day 4. I had a gig. Then I went and I just played my ass off. I couldn't, I had so much more facility, and decent ideas, and the willpower, and the attitude that I wanted to play. Which was not just the physicality of it, but the motivation behind it. Because once you start to lose your fine motor control, you don't take as many risks, obviously, in a creative field like playing music. That's not a good thing. Before I was diagnosed, I could feel my playing slip away, particularly the right hand. I play a lot of jazz, which is very motion dependent, and chops is what they call it, technical facility. And that had been disappearing for probably a year and 3/4, maybe 2 years before I was even diagnosed. I just chalked it up to getting old. Once we were diagnosed, obviously, wanted to do something about that, and the pharmaceuticals really didn't help that. It helped slow down the deterioration stuff, but it didn't give me anything back. Before we got into this program here, like I said, once I got my brain chemistry straightened out, I was able to play better, but maybe still I was about 65% of where I was in what I consider 100% of my level of talent. I was only able to utilize maybe 65% of it. Shockingly, like I said, even after 4 days, that night I just I felt really, really good, very positive. I had a lot of energy, and I've had a few gigs since then, and the same thing. Good energy, good set of ideas, and some of the technical facility to pull it off. So I was talking to Dr. Kukurin about this, and he asked me the same question. We were talking about percentages, and I really feel that I'm up to 75, maybe 80% of where I was in my prime. So we went from, let's say, 65 to 80 in the course of less than 10 days, and that's I'm still flipping out. My wife, who's seen me play since 30 years now. You know, even noticed it, you know, she's, you know, she couldn't believe it either. So, you know, I'm pleased as punch.
Beautiful.
You know, it's a good thing.
Definitely.
I want to thank Dr. Kukurin and Lori and the office staff for making me part of this number. It's been a real turning point in my life for the positive. Thank you. I feel really good. I mean, I feel much more hopeful of, instead of just stopping the slide, actually returning some of my facility, not just for the piano playing, but you know, for, you know, social interaction, because one of the things, it's very isolating disease, because you go out, you know, you don't want people to see you, you know, shake and stuff like that. You know, it freaks them out a little bit and stuff like that. So basically, you know, I have a lot less anxiety about talking with people, because my voice would, you know, falter and stutter. And back in the day, you know, I'm very fast and quick-witted, as everybody can tell from this interview. You know, and I had lost a lot of that quickness, and so I'm regaining some of that back, and it certainly is a blessing. I'm very fortunate to have this opportunity to do that.
Last but not least, Chris, if there's anyone listening to your interview, hearing about this treatment, the cranial nerve non-invasive neuromodulation, what would you tell them if they were considering trying this treatment?
Well, you have absolutely nothing to lose. Like I said, it's non-invasive. It's basically just an electrode that you place on your tongue to stir up your brain. There's a lot of, you know, you look at the internet, there's a lot of quackery and fakery, and people who are ill and with any disease are looking, you know, for something that will help stop the pain, or in this case the symptoms and the associated, you know, mental duress. I'm by nature a fairly skeptical person, and you know, I can't argue with the results. Even after 4 days, you know, and then playing a gig and having really 20% more output available to me, you know, physically and mentally, it's incredible. You know, I'm pinch me. You know, it's just crazy, man. So I would say if you have an opportunity to try this, you have nothing to lose. It may not help you as much as it helped me, or it may help you a lot more. But give yourself the benefit of the doubt and give it a try. If you buy into it, I'm sure you have good results, because I'm very pleased with what's happening with me.